Hi, everyone. Welcome to MIT Press Live. My name is Hannah Nyren. I'm the Digital Marketing Manager at the MIT Press, and I will be your host for this series. Today, we're speaking with Joshua Gans, author of Economics in the Age of COVID-19. Hi, Joshua. How's it going?
Hi, fine.
So I know you've been really busy this past week.
Indeed.
You're probably the busiest person during this pandemic right now.
I doubt that.
But you have been cranking out a lot of work. I know that you put together this book very quickly, so we appreciate your productivity.
Thank you.
So to start off, tell us a little bit about yourself.
So I'm an economist. I am at the Rotman School of Management at the University of Toronto. I teach mostly entrepreneurship and innovation, but I've written a number of books in my past trying to translate economics to a popular audience.
Awesome. So tell us about this book specifically.
Well, this book is obviously about the COVID-19 crisis. It was written during the crisis, starting in March. And it's basically an attempt to take the whole raft of economic issues that were being thrown at us really in real time and look at it from an economics perspective and try and translate some of the choices and conundrums that were being faced so that maybe people could use it to help process what was going on, to understand government policy, to work out who they should or should not be, I guess, upset with, and maybe even how they should think about their own place in all of this.
Yeah, and I'm sure there's a lot of demand for this information right now. I know you wrote an article before all this happened and it got a ton of views. So I know that, people really need this information right now in order to kind of wrap their minds around what's going on, but also figure out solutions for making it better. So what really inspired this book? I know you mentioned it a little bit, but can you tell us some more about that?
It was really born out of, I mean, I wish I could say that I foresaw everything happening in January and set us out writing a book because I was ahead of the curve. I don't see myself as that at all. I was in the midst of it and didn't really know what to do with myself. I found myself staring at data and other things, just trying to understand this myself. And after a week of that, decided, well, what can I do that is productive? And this was it. And the hope was that I would do this and it would be of use to some people.
Well, I'm glad you were able to do something productive with it. So, we've given you all some background information. So now Joshua is going to present a little bit more information about the content of the book. So take the floor, Joshua.
Let me do the usual Zoom awkward sharing of screen where I ferret around for my talk. I share it and you can see it in its glory. Then I finally work out how to start the presentation. Okay, here it is. So this is just a brief introduction to my book, Economics in the Age of COVID-19. It's got a usual provocative cover. It's only available as an ebook thus far, but we've been working on a new edition that's we've got a lot more material and up to date that will be published sort of normally around November. So this book was written on it was published on the 22nd of April. So some of what I'm going to say today is in fact going to move beyond the book in terms of my own thinking as well. One thing that really assisted me as I was writing this was that there was a huge amount of economic research that was coming out as my economics colleagues started to refocus and work out what they could do to shed light on what was going on. And it was quite an overwhelming amount of work, but part of what I aimed to do in the book, and also its new edition, was to process that economic research and translate it to a broader audience. And so everything that I do here today is really resting on the shoulders of so many economists who have been working on this over the last couple of months. Now, when you come to a talk about economics in the age of COVID-19, I think the expectation may be that I would focus on sort of traditional economic things, that especially given the magnitude of the economic crisis that has come alongside the pandemic. So you might have expected I might have talked about unemployment, which is skyrocketing, measures to support income while people are social distancing, the consequences of that in terms of the national debt, and other pushes to interfere or not to regulate markets, but with price controls. Those are things that I do talk about in the book, but I thought by way of introduction, I would talk about the economics that are really closest to the pandemic itself. In other words, all of these things here are all symptoms of the pandemic, and they are huge in terms of their impact and what what we will have to manage going forward. But I don't have anything unique to say about them. What I have in terms of uniqueness is about thinking about the underlying crisis itself. And so that's what I'm going to concentrate on here. The big takeaway I want to give you from this part of the talk is that pandemics are manageable. There's a sense in which, and I was guilty of this myself in March, of thinking, oh, a pox is upon us and we're going to have to see ourselves through it. And, there was not much we could do. But that actually turns out and is the wrong message. Pandemics are a manageable phenomenon. And let me explain why. You have a number of people in your society, and one of them becomes ill. And what you want to do with that ill person who's carrying an infectious disease is you want to take them and isolate them from the rest of the population. And you do that while they're infectious, and then when they become better, you return them to the population. Now, if you're able to pick everyone up in that way, the pandemic does not spread, and so does not become the big problem we're facing today. Now, that might seem a little idealistic. Obviously, what we seem to have happened is a situation where we didn't manage the pandemic, and we didn't take these initially infected people out of the population for a period of time. And so the virus spread. And as it spreads, the possibility of being able to do this active management of the situation becomes really, really hard. And so you don't have that luxury. So even with some of the lockdowns we've seen, it's not like we've really been able to crush this virus. So what you are forced to do in that environment where everybody spreads is you're forced to do this. If you have no way of taking these individuals who are infected out of the population, either because you have not been acting or alternatively because you didn't know who they were, and there's a combination of both going on here, you're forced to do this. And what this does is it treats everybody as an infected person and isolates them. And sometimes that has its own problems in terms of spreading within, say, a household. But also, we can't isolate everybody because we have essential workers. And so you have this problem as well. So what you're forced to do when you don't have information is you're forced to treat everybody as if they're already an infected person and try to deal with it that way. And you can see automatically the costs associated with that. That's when everything balloons out, even if you're not having a huge spread of the virus itself. So what you really want to do is, if you had your druthers, what you'd have is a situation where you could take an infected person and imagine a world in which that infected person wasn't just infected that you couldn't see it, but it was a virus that caused their nose to light up like Rudolph the Red-Nosed Reindeer. Well, as soon as you see someone with these big red noses walking around, you can then do what we want to do, is take them out. In other words, the problem we face, if we're going to actively manage this, is we have to be able to identify these individuals. And if your virus, as it is with the novel coronavirus, doesn't show up in terms of bright red symptoms right away, that's very difficult. You have to instead actively pursue that information through testing and tracing, as I'll come to in a second. So the bottom line here is that pandemics are a manageable thing if you can solve what I call the pandemic information problem, which is basically identifying infected people as rapidly as possible, isolating them until they're no longer infectious. If you can do that, you can manage pandemics, because fundamentally pandemics are an information problem. They are a problem for the whole of society when we can't tell who is infectious. The problem with this being an information problem is we don't have a huge amount of information on COVID-19. Still now, here's some things we do not know. We don't know who is infectious. We cannot tell. People are asymptomatic or pre-symptomatic for 4 or 5 days while they are able to spread the virus. And more generally, we don't know how many people have COVID-19. We don't know how many people had COVID-19. We don't know how many people will be sick from COVID-19. We don't know how many of those people will be permanently harmed or even die from COVID-19. These are still only rough guesses we have. We don't know what makes the novel coronavirus that is at the heart of the COVID-19 disease that causes all the problems. We don't know what allows it to spread. Does it spread indoors, outdoors, crowds, not crowds, what sort of crowds, what sort of environment, what sort of airflow, lots of issues. And we don't know how long people are infectious for when they have the novel coronavirus, and sort of afterwards as well. And then finally, and this is a big one, we do not know if people can become immune and have develop antibodies that allow the coronavirus, if it comes into their body, to be suppressed right then and there. We don't know that either. We're confident about it, that it's going to be the case, but we don't know it for sure. And what we don't know influences how we end up getting out of this, the end games. So there's sort of 2 broad end games we have. One is that we develop immunity some way. One path for that is to let the coronavirus run its course. That will probably take about 3 years to have happen. It'll involve a lot of harm to health and quite a lot of harm to the economy as well, because people do not like to just let themselves become sick. They take actions. The other way is if we get a vaccine, but the time frame for that is 1 to 3 years, and that time frame is itself, the upper bound on that is very, very optimistic given what we've been able to do in the past. The health harm, if we get a vaccine, is very low. The economic harm can be very high because we have to wait out the vaccine by staying in a very strong lockdown if we don't want to have health harm. So it's a real issue. The third sort of broad, the other way other than immunity from dealing with the coronavirus or any virus is to suppress it. And you can suppress the virus by solving the information problem. In the case of COVID-19, that means test, tracing, and isolating everybody. It would end this whole thing in 3 to 6 months and will result in low health harm and low economic harm as well. So it's very clear what we want to be doing. What we want to be doing is suppressing. Then we don't have to think about trading off health versus economic harm at all. So that is surely a desirable path. And this is not just me pontificating here. We have evidence for this. We know this. For instance, in the SARS outbreak, the first coronavirus in 2003, this was the path of the number of cases of SARS worldwide. And you'll notice that it sort of starts building up in January, and by May it's over. By May it's over. So that's extraordinary. In other words, we had a virus which was far more infectious than COVID-19, far more deadly. 10% of people who caught this would die from it. But it was dealt with very, very quickly, and not with a vaccine. We don't yet have an officially approved vaccine. There is a candidate, and not with it exploding all the way around the world. There were a number of countries who were affected, but not too many. But the point is, look how few cases there were here. Maybe 7,000 or so. Nothing. And we did it again with the MERS disease. That came in 2015. And here you can see it was suppressed very, very quickly. Most of the cases ended up occurring in South Korea. It was dealt with in a matter of 2 months. And this one doesn't have a cure at all. This one, in fact, it's not even clear that we can develop immunity to it. So it's a little bit endemic. It sort of pops up again from time to time, but we dealt with it. In other words, this is possible. And we know from our current case that we can do this too. South Korea and Taiwan have both been successful in suppressing the virus without widespread lockdowns. Australia, New Zealand, Israel have been successful in suppressing the coronavirus with some lockdowns, but they suppressed it, gone. It's, manageable, can deal with. The economy can go back to normal. It's everybody else who didn't do this that's causing our current problems. So if you think about that, it's reasonable to ask, what is our plan? I asked this in Canada. I would ask this of the US and the UK and other places. What is the plan? Because it doesn't look like suppression. It doesn't look like suppression. And so it's some immunity run, which doesn't sound very good to me. And the interesting thing about suppression is we can do that now. There's nothing stopping a massive push to be able to do that. Now, one of the things, of course, we do in helping along that is we help ourselves. Here's a cartoon from a couple of days ago. People actually don't tend to rely on the government to say, keep yourself safe and to social distance. There is some effect of that, but it's not the majority. In fact, the number one contribution of economists in understanding epidemiology, which is itself a social science, is to note that people will adjust their behavior, social distancing prevalently, but also protective gear such as masks, etc., as the risks change. When they perceive high risks, they back off. When they perceive risks are low, they go forward. That actually has an effect on the progression of the virus. Here is some data from SafeGraph, who's been providing a lot of data on mobility. The blue line there represents point of interest visits from March 8th to April 12th. The official sort of lockdown began at about March 21st or so. But you'll notice that people were already stopping visiting point of interest well before then. And in fact, the lockdown itself, just sort of was almost irrelevant. And you can see that this is in the United States from the red line. The red line shows the percent of the population on any given date that was under a mandatory lockdown. And you'll notice that it's going from nothing to almost everyone. And interestingly there, it doesn't seem to affect the rate of social distancing going on in terms of people not turning up at point of interests. So what would this look like in terms of managing the loss of containment? Well, if people engage in behavioral social distancing, rather than having this increase in infections and then a drop down as people become immune, what happens is something more like this, is that infections start rising at a certain rate, and then they sort of flatten out and they persist for a lot longer as a result of that. So this flattening the curve is something that people do themselves over the course of the coronavirus, and they ended up in a sort of stable situation until such time as enough people are immune or a vaccine appears. And this means that for things such as the reproduction number that you may have heard about, which I explain more in the book, it tends towards 1 in the data. In other words, right at the edge of whether you get a pandemic or not is where people end up with. And there's some economic reasons for that, but I don't have time to go into them right now. And we've seen in the United States and Canada the same rise up and then flattening down pattern going on. And this occurs also in every individual state and in every individual city, similar sorts of patterns. It's kind of fractal in that way. So what do we do then in this environment that gives rise to this? So one way we can do if we wanted to suppress or get these numbers down further is test people. The problem with testing people is that unless you're testing everybody all the time, somebody sort of gets loose. And so you could test this person and then isolate them. But the problem is you might isolate them too late. And so you're kind of one step behind the virus because this person's already infected some other people. So what we do is we try to get ahead of that by saying, oh, who has come into contact with somebody we now know has the coronavirus? And so we trace them. And that allows you to be one step ahead, and we can get people into isolation a little bit earlier. Now, some of those people might not be infected. So it is costly. And it also requires us to have a lot of knowledge about people's movements, etc., which is something that I take up in the new edition of the book. But it is an effective way of dealing with these things. And countries that have been very effective in suppressing the coronavirus have all done that. They've both tested widely and they've also engaged in tracing activities. And when you do that, instead of having this rise in the curve, you get a rise and then it comes all the way down and goes to nothing. And that's really what we should be trying for here. And you can see what that means in South Korea versus Spain. South Korea did testing and tracing, Spain did not. South Korea got some mild reductions in economic activity, but not the same as a country that was hit very hard by this. So it's not like you get off completely for free, but it's a lot cheaper. So in the book, I divide all this up between 4 phases and talk about issues associated with trying to contain the virus once it's got loose and everywhere, trying to then reset and do this suppression, thinking about how we recover and open up the economy and how we innovate for things like vaccines, and then have some remarks about the future as well. And I've mostly talked about that reset thing right now because I wanted to highlight it, because as I did this book, these issues changed in terms of their salience. So, there's always some that are more relevant right for now than for others. Just to give you a forecast of what's coming down the pike is when hopefully we get a vaccine, we're going to have an issue is that there's not going to magically appear, as some might say, a vaccine and all the doses will be available for all everybody in the land right away, let alone the world. So it'll have to be rationed. And one of the decisions that I'd be urging governments to do is to think about how to ration vaccines. They have thought about it. This is from the CDC. I've thought about how to ration vaccines for things like the flu, and where basic key occupational groups get it first, and then also an assessment of health risk. But you'll notice that the first candidates for vaccines tend to be infants and toddlers, which right now, given what we know about this coronavirus, may not be the right link. And moreover, these sort of making a list and putting people into categories basically doesn't cover most of the population. And so how are we going to allocate vaccines to them? I suspect it'll be some sort of lottery, but I think the world needs to be prepared for what that would look like, because it could take some time. So if I want you to leave one just lessons for the future here, I only have one: that this was an entirely manageable crisis. That's the thing that I want you to take away from this talk. The book is always talking about what you do if you don't manage successfully. And it also talks about how to make this a manageable crisis. I think obviously right now we're trying to manage the crisis we're in, but sometime in the future we'll want to hold our policymakers to account for what they should have done. And the idea that this was manageable should be something that we should start to entertain very seriously. Okay, that's the end of my formal part of this talk. I'm now happy to take questions.
Great. So there is a Q&A section at the bottom of your screen. So if you have any questions, you can go ahead and ask them there. I'll give you all a second.
Well, let me just start by answering some of them, since I'll do it in the order that they appeared.
Sure. If you don't mind, I can go ahead and ask them.
Oh, yeah, sure.
So if pandemics are fundamentally information problems, do you think they are susceptible to disinformation campaigns, the likes of which we often see on social media, in parentheses, fake news, trolling, deepfakes, etc.?
So I think misinformation is something that comes alongside pandemics. And I think for part of the reason is because we are sitting there grappling with a lot of uncertainty. Now, some of that misinformation are things about, what might be a treatment or something like that, or what is the value of actions such as social distancing or wearing masks. And really, the issue, the frustration I found is in the communication of those messages. I think there's a tendency for a lot of people, and this is experts, politicians, and others, to want to make very clear prescriptions, like, oh, you should not wear a mask, or you should wear a mask, one or the other. Where in reality, because this is a changing environment, these sort of blanket policies are eventually going to sort of be found to be wrong in one dimension or another. And so people learn that. And I think it'd be much better if this messaging occurred in a more, treating people like adults way. We think, wearing a mask is a good idea. But right now we need to prioritize those for healthcare workers, etc. So we do not want people to rush out and start buying them. And if that happens, we will have to ration the sales of masks and things like that. And I think dealing with it that way would be better than trying to get everybody not to buy a mask by basically saying for sure that they weren't useful. Because the problem you face with that is the problem we did face, is when they were useful, then people didn't know what to trust. They didn't know what to think. And that seems to create a more messy situation.
Great, thank you for your answer. So we have another question here. In your book, you highlight the point of view of health being more important than wealth. Now, as we see more and more economies opening up, is this going to end up in disaster?
Well, it depends which economies. If you're an economy where the apparatus was in place to actually suppress the environment, you can continue to suppress the environment. There was a very influential Medium post put out called The Hammer and the Dance. And basically says you want to suppress the virus with a hammer, and then you have to dance around until such time as you have a vaccine or something like that. Or you get rid of the virus entirely. The problem with getting rid of the virus entirely, it really requires it worldwide to do it properly. For other places, I worry as much as the next person. Here in Ontario, we're still averaging between 300 and 400 new cases a day. I do the probabilities in my head, say, well, I could go out and the chances of me encountering one of the infected people is very low. But I know that if we all did that, then in 2 to 4 weeks, we'd be back up at very high infection levels again. And we tend to see that. Now, there are some saving graces. While economies are opening up, they're not opening up in the way they were before. They were opening up with a more wary public. They are, we don't have the big events. We don't have, sadly, the schools and other things like that. So, I would expect to see some rise in infections. And the question is, whether we'll have some of these events and it turns out to be more of a spread or not, and we have to do something about it again. And that's where it's just very difficult to tell at the moment. If you are suppressing the virus, as they were in New Zealand got down to a couple of cases a day, and they still didn't want to open up the economy because they wanted to get down to zero. And that's a really tough thing to do. Say, I know there's nobody out there with this virus, but let's all wait inside for 2 more weeks just to make sure. That takes some real leadership to be able to do that. But succeed, and then you really have a much better time for years following. And I don't think we're going to get to that stage here in North America.
Great, thanks for answering that question. So how do you see the reactions of the pandemic varying from country to country?
Well, I think the simple, it's obviously widely. There've been very different responses. Sometimes within countries that we think are stereotypically the same, such as Scandinavian countries, there have been different responses. But if there's one thing that I think distinguishes having a good response where you suppress the virus versus the rest, is your previous experience with viruses. There's a good reason that East Asian countries have done better with this, because they've had viral outbreaks before, SARS, MERS, etc. There's a good reason why some other countries, such as African countries, are seeming to do better with this. It's because they've had the Ebola outbreak and similar things like that, so they have more active management of viral spread. And I think for the same reason, you look at Europe and North America, who largely felt themselves, well, the last time we had pandemics, it was fine, we didn't do anything, and didn't have or didn't enact plans that they had. That's where you see the problems arise. And so I think it's his experience that gives rise to a better response. But I'm sure there are other factors as well. Australia and New Zealand did not have previous pandemics, not since 1918. Yet they seem to have done well. It could be that there was just luck, because both happen to be islands. But, these are things that we will hopefully get a better understanding of. But one of the things that why I want to emphasize this is when this is all over, and it will be over, I worry that everybody says, well, I've done enough of this pandemic stuff, and there isn't enough pressure to really get those plans and other things enacted so this doesn't happen again.
Yes, I would hope that it doesn't happen again. So someone does ask, wouldn't social distancing be better described as physical distancing? I don't know if that's your area of expertise, but what do you think about that?
Obviously it would. I don't know who came up with the term social distancing, but what we do mean is physical distancing. We mean by that we have to manage where people actually come together. And I'll just paste that. I've been thinking a lot about that, and I had a publication in MIT Press Technology Review just a few days ago that I placed a link in the chat, because this physical distancing, as we reopen up, the problems that were previously the problems of all public health officials to try and manage are now going to be pushed down to management issues for people who have physical spaces. And so they're going to have to think about all their own policies to contain and make employees and customers and suppliers and contractors and anyone else safe who's interacting with that environment. So that's where physical distancing or physical preparedness is going to come into to play. And so anyway, in that MIT Press, MIT Technology Review article, myself and some colleagues talk a bit about that. It'll be familiar given you've just heard this talk.
Yeah, definitely. So we have another question here. With the reopening of businesses at limited capacity, how do you see this impacting demand, labor models, and employment? What recommendations do you have from a policy perspective on recovery?
So while the virus is out there, we don't get back to normal behavior. Obviously, some industries are going to be hit more than others. You know, I don't think, no matter what you think about restaurants, they don't feel that inviting at the moment, a place to be in. You probably aren't going to go to rock concerts soon. Even travel itself, and travel for holidays or any other things is going to be an issue. So there are some sectors who are going to be hit and hit for a long time, and that, you know, that is going to be really tough to manage. Now, there is some saving grace. There are some other sectors who have actually expanded employment. Anything to do with online delivery, etc., has actually expanded employment. Is it enough? Probably not. A lot of workplaces are now moving to work from home. That's good in one level. Those workplaces can stay going on. It's disruptive in another, because there were entire communities and other things built around the fact that people went to work, and also the fact that people went to school. And so I think that is going to be very difficult. You know, different countries respond very differently in terms of their willingness to spend money today to support the incomes of those who are having that sort of disruption. I don't think any economy or government has ever been prepared to be able to do that for a number of years. So that is quite a serious thing. But they could be more innovative about it. For instance, you know, testing and tracing takes people. Testing and tracing is also a thing that can shorten the cost to the economy. So you could easily retrain people, have them employed, and redeploy people to be able to do these tasks. And so I think there are opportunities there, but I think very few governments have grappled with the extent of the problem. I haven't seen any sort of government who said, oh, I think we're going to be with this for a couple of years, so here's what we're going to do. I think there is still a tendency to hope for a miracle. And I guess, you know, I don't mind people trying to cope with their lives by hoping for a miracle, but I expect our leaders not to.
Thank you for your response. We have another question about the people making decisions in these matters. So the people making decisions about how to deal with a pandemic are not as susceptible to the fallout of it as the other people. And that holds true for hierarchies in organizations. So for example, lawmakers might have more ability to protect themselves than the people that they're making the laws for, but also organization owners, like a supermarket owner, may not have to be in the market. A university dean doesn't usually need to teach, though I do know some that do. And they are pretty secure in their jobs. So would you trust that they are making the best decision for the overall population?
Oh, I'm an economist, so of course not. You know, whenever you have a difference of interests, that should be a thought that you have. Are they going to make decisions in the national or social interest? And absent any mechanism, you'd be concerned about that. However, there are mechanisms. One mechanism for politicians is their future livelihood or their ability to retain power normally is related to how well they tend to lead. So there is some discipline there. Similarly, if you are a supermarket owner, if you let a lot of your customers or employees become sick, that's not going to be good for your future business. So I think in terms of, keeping a brand name reputation and things like that, I think there are adequate incentives to try and do best. I think the bigger problem that decision makers face is that lack of information of what is the actual best thing to do. Because any way they go involves some risk. And all we can ask of them is to consider those risks and make judgments on them. One thing we have to be a bit cautious about whenever anybody takes a risk, even a reasonable risk, is punishing them for things that they were out of their control. That is looking at the outcome. And we've already seen a bit of that in political discussions when we did all the social distancing and the lockdowns, the virus didn't spread as much. And people said, oh, look, the virus didn't spread as much. Maybe we didn't need to do those things. And the problem is, of course, we don't know whether we did or did not need to do those things. But at the time, that seemed like a reasonable proposition. And in fact, many people believe, who are experts in this, that it did save a lot of lives, etc. But it's very hard to look at the outcome and know what the alternative timeline looked like.
Thanks for your answer. So we have another question. What if most of the expenditure on health is personal, both for the patient as well as the medical doctor / philanthropist? And I know, living in Canada, you might not have experienced this, but in the US, we have to pay a lot for our own medical care.
Yes. I mean, the reason that most countries in the world have national healthcare provision, that is allowing anybody to get healthcare at either zero, as we got in Canada, or very low cost, as happens in other places, is out of the experience of the 1918 pandemic, which killed more people than in World War I and World War II combined. So that experience caused people to say, well, we can't afford to have people who are sick, not being able to go and get treatment, and also at the same time not being, being sort of required to go to work, or they might lose their job. So it's not just health insurance, but it's things like sick leave, etc. And so a lot of countries, and some of my economist colleagues formerly call these oppressive labor market regulations. But the reason they were done was so at times like this, individuals would end up making the right decisions, and that would help everybody as a result of that. So I think, that is going to surely put on pressure at other places who have not adopted those policies, this experience of that. What that looks like, etc., I don't know. It's very hard for me as somebody outside the United States to fully understand some of the choices that are made.
Great, thank you. So here's another question. One of your slides, entitled Endgame, positions the present method as low risk and just a few months of harrowing times. I'm not quite sure about the phrasing of that.
No. So yeah, no, that was not the present method. That was the desired method.
Okay, so we're not quite there.
The desired method is to suppress the coronavirus with some active, testing, tracing, etc., for a number of months. The method that's being pursued most in a lot of places is just to slow down the rate of infections and essentially to wait out for a vaccine. And the reason that that's costly is because all those actions of slowing down, causes the economic depression that we're probably in right now. So I think it is a this is why this is brutal economics, because we've put ourselves in a position where we have to trade off how strong the economy is versus how healthy the population are. And that's the sad part, that we have to make that trade-off. But I think that I don't think the end, and I think from this question, I don't think the end is that we end up in a totalitarian state. Although, let us be very clear, having prolonged economic depressions has in the past been a precursor to that sort of thing. So we should definitely be vigilant about it. But I don't see anything inevitable about that. I think this will eventually just pass, and we will reflect on it as a horrible period, rather than something that fundamentally pushes us off the path that we've been on for the last century or two.
Great, thank you for your answer. So what are some of the changes in consumer trends that you think are here to stay even after we have fought the pandemic?
Yeah, that's a great question. So, I spend a lot of my time studying technology and innovation. And one of the things that we find quite interesting there is how long it takes for innovations to proliferate throughout the economy. There seems to be a lot of inertia to adoption. Not everything is like smartphones, so it's probably one of the fastest ones where everybody sort of drops it and gets it within a decade. Most take a lot longer than that. In my sector of university education, we've talked about online education for 2 decades with very little movement in it, despite thoughts about some of the advantages that might have in terms of access to the best experts or the best teachers, the ability to save money on physical lecture theatres, etc., etc. And so, that was always talked about, but nothing much happened. And people just thought it was too hard. No one would ever learn how to do it, etc. Well, we've just seen in the space of, just a few weeks, we moved from virtually nothing to 100%. Now, it won't stick at 100%. What we learn from that is we learn the things that we like about our online education, because we've all given it a go for a while. And we also work out what it doesn't do. And there's a lot that it doesn't do. But it's as if, you've been able to accelerate people trying out stuff in a mass way very quickly. And the same is from work from home, from online deliveries, all this sort of stuff. Very much that's sort of those sorts of sectors. And people have learnt about it. So I think it's going to accelerate and be with us things that have worked anyway. Now that we've all got over the hurdle of trying this stuff, if we do like it, we'll stay doing it. If we don't like it, we will revert back. But we've now all had a chance to see what we do and do not like. So it's going to be quite interesting that way. But in terms of other things, people sort of say, oh, travel is dead. Well, I don't think travel for pleasure is dead. Some travel for business might be dead, because people worked out, it's not really worth it spending a day traveling for this meeting when I can do it over Zoom, and everybody's got used to that. So those sorts of things will be different. There'll be more working from home and things like that, but that's just part of a trend. But I don't think we'll never see rock concerts again, or we'll never see, large gatherings and etc. I think those things will happen because there was always a reason for them to happen.
Yeah, I mean, there was a pandemic in 1918 and we still have baseball games. So I'm sure at some point things will go back to normal.
Right. Unpopular teams, they probably could have an audience right now naturally socially distanced in a less crowded stadium. So,
I'm sure lots of baseball fans would argue against the authenticity of that. It's not the same as the stadium. But anyway, we have a couple more questions and we have 10 minutes left, so I think we have time to answer them. So if governments were to start tracking data, um, what data do you think they would start monitoring? So I guess the full question is, with information being so important to effective management of this and future pandemics, what monitoring methods, besides standard mass testing, should various levels of governments be investing in? For example, sewage monitoring, though I feel like the examples might vary.
Yeah, I think there's got to be a lot of that. And it's not just governments, it's private establishments now too who are opening up, need to monitor, basic health. And so, where possible, large scale testing, both for the presence of the virus and also for the presence of antibodies, is something that governments need. And I think they're turning around and starting to do that. Just last week, I think, Wuhan, China, which had the strongest lockdown of any other place, quite so, just tested 11 million of their citizens for the coronavirus in a week. Now, why did they do that? They wanted to see where those little seeds of the virus re-emerging were, and to be able to clamp down on it before it becomes a big problem. So, if I had my druthers, we would do that. Paul Romer, who's a Nobel Prize winner in economics, a month or so ago, advocated this for the US, continual testing. Part of the reasons he did that was because he didn't think that tracing people and contact tracing was going to work. But it does tend to work in the countries that have done it. The issue with tracing is it raises privacy concerns. And, health is always an area where privacy and the need for information really collide. My personal opinion is that I am more trusting of government authorities, and I would rather see them have more information and sacrifice a bit of privacy, but I know that's not everybody's choice. And that's been a real issue in trying to get this information. The other thing it can be doing is just properly sharing information with similar standards with other jurisdictions. Early on in the UK, any deaths in long-term care facilities from the coronavirus were not counted as such. So they had inaccurately worked out what the fatality rate was. Well, if you don't know what the fatality rate was, how do you know what the benefits are from locking down your economy and working out what to do? So these things have to be done. And, a lot of scientists are sharing lots of studies and there's a lot of work going on. But boy, our information was poor, and was poor in terms of a sharing sense. And I think one of the reckonings that we will have to deal with, because this is a global risk, is sharing of that information between governments at an earlier and earlier stage, and common standards, etc. It just hasn't been done.
Yeah, that's a really good point. And especially with the increases of regulations around data privacy in the past few years, it's really not a great time for governments to be asking for more data.
It is, it is true. It's not a great time. But, if not the governments, then I think this is going to be happening in the workplace. I don't think you can make workplaces safe with no information. Mm-hmm. And so you're going to be asking information of people. Now, some of that, if they're external to your organization, hits up against privacy rules. If you've got employees or you've got students or something like that, that's different. So that's going to complicate things.
Great. So I think we're wrapping up the questions, but I do have one question left for you. And that's, there has been a lot of talk about how this pandemic situation has disproportionately affected the poor and people of color. What do you think can be done to, create a fair economic system that helps those people recover from this situation?
Well, I think, this is something that happens so often with both health and economic crises, that the people who were disadvantaged previously become even more disadvantaged now during the crisis. I think ultimately this comes down to being able to have policies not in the midst of a crisis that help get rid of social inequities and other things like that. And in fact, my last book for MIT Press, just last year, entitled Innovation Plus Equality, was outlining a whole lot of ideas along those lines. It was meant to be a prescient primer for policymakers on these issues, but I think, as with everything else, has been thrown out the window right now, including by myself. But there are things that can be done, and it's not just on the basis of race or poverty, but also on the basis of gender. One of the interesting things about this depression that we're facing right now is actually depressions tend to be relatively more harmful for men than women, and have been in the past, but not this time. Not this time. It's the reverse. So I think there's no there's no economic magic book of how to deal with these things in the midst of a crisis, other than being sensitive and understanding for it. That is the sad fact of that. But ultimately, our experience of this should just hopefully put us under more pressure to right wrongs when times are not as turbulent.
Interesting. Well, thanks for sharing that. And I'm sure your other book, Innovation Plus Equality, might have some more information.
Yes.
Awesome. It looks like you're creating quite the, catalog of resources for us to use.
I'm not here trying to sell say. You are, but I'm not.
We're talking about the content here, but it's interesting. I'll have to look into that one a little bit more too. Thank you again for talking with us today. Is there anything else you'd like to share with our audience before you log off? Is there somewhere they can ask you more questions or anything like that?
Certainly I'm on Twitter at Josh Gans. Happy always to hear comments and things through that mechanisms. It tends to be the easiest. Things are evolving. I hope this book stays relevant for people for a little while yet. But I don't doubt that there will be some things that I misjudged. We'll see how that all plays out.
Yeah. Anyway, if you want to find the book, you can visit our website at mitpress.mit.edu. I've provided the links in the chat. And then you also have a new book coming out. Well, a different variation of a similar book. So can you tell us a little bit about that?
Yeah, so we planned this as we did this. MIT Press did a phenomenal job, unprecedented really, of taking a book that was written quickly and then turning it around and publishing it quickly as an ebook. And part of the plan was to take a bit more time to add some chapters and add more material. So I've basically already just finished a book that's about half of this book and half new content. So it's much longer, and it's going to be called the Pandemic Information Gap, the Brutal Economics of COVID-19. So much closer to the theme of this talk than the present book is. And that will be published in November on a more normal cycle with a print book and other things as well.
Yes, and I should note that this book, the current book that we're talking about, Economics in the Age of COVID-19, is the first book of our First Read series, which is digital first. Do you have any more information on the series? Because I feel like you're a great spokesperson for it.
I don't. I just know, if there are anybody out there as an author thinking about utilizing it, it did work out, and it worked out in terms of being able to do it. I don't think it would have been worth writing a book at this time without the support of a publisher and being able to accelerate a peer review process through that. And so I thank MIT Press for that opportunity.
Okay, cool. Glad it worked out for you. All right, so that's it. If anyone has any questions, feel free to tweet at Joshua Gans. He gave you his Twitter. And again, if you want to learn more, we have more information in the chat. Anyway, thank you all for joining us. I'll see you next week, same time, next Tuesday at 12:30 p.m. Bye, Joshua.
Bye.
Thank you.